Us till now. Of course, this is Morning Vibe, and on Tuesdays we take care of your health and wellness matters or aspects or issues for that concern. Now, today we're speaking about a very common, very interesting aspect, which is called sinuses. You know, what are the facts and myths about sinuses? What do we think we know that is true, or what don't we understand about it? And of course, with us we have Dr. Ian Majala. He is ENT head and neck surgeon, sleep medicine specialist. He'll be here, of course, to give us a good perspective of what we need to understand about sinuses. It's a simple thing, but it's also simply complicated because most of the things we may know are not actually true, and some of it is quite the opposite, so vice versa for that matter. But you know me, I like putting you on to amazing, dope things. And guess what? We had him here in studio. That would be last week. And I'm speaking about Glenn Washington, the legendary Glenn Washington. He'll be performing at the KICC on the 19th of October. And he will be performing from 6 p.m. till late. You know his songs, they're legendary. They give you nostalgia, that good nostalgia of, you know, back in the day when I heard this song, I was here and there. Now imagine hearing that live. And you know what? Glenn always has a story, you know, to tell. Every song that he sings has an amazing, dope story. So make sure that you tune in, keep it here. And I know and understand that we'll be giving out, of course, tickets for that matter, free tickets. So keep it here, you know, keep your ears locked to the ground and make sure that you, you know, register and be at the KICC on the 19th of October at 6 p.m. till late. Right, that mentioned, let's get into a conversation today with Dr. Ian. Dr. Ian, thank you so much for coming.
Asante sana.
You know, Dr. Ian, I've had several myths
Yes.
About sinuses. In fact, I was a bit ignorant. I used to think they're a bad thing.
Yes.
I used to think they're a bad thing. In fact, before I even get deeper into it, let me engage our audience with our question of the day. Yeah. We are asking you, what is a common myth you have heard about sinuses? What is a common myth that you have heard about sinuses? Please tell us what your thoughts are, what you've heard. Our social media handles are right there on your screen. That is Facebook and X, and we use the same handle, which is at K24TV. And our WhatsApp line is right there on your screens. What is a common myth you've heard about sinuses? Right.
Yes. So, Remy, actually what you said is very true, that everyone is scared about sinuses. But can I shock you? Yeah. We all have sinuses. What we don't have is sinusitis. So those are two different things. So what are sinuses? I think that's the first place to start, okay? Yeah. So we have, sinuses are these pockets of air in the bones in our face. You have them below your eyes, above your eyes, in between your eyes, and behind your eyes. So you have four pairs: maxillary sinus, frontal sinus, ethmoid sinuses, and sphenoid sinuses. And they become fully developed during your late teenagehood. Okay, so as a child, you have very small sinuses, and then as you grow a bit older, then they become bigger. And so the first answer is we actually all have sinuses. And what do sinuses do? The short answer is we don't know. But we think that they help with certain things, okay? Yeah. So like one of the things is that they actually make the bones lighter of the face. Number two is
the skull.
The skull bones, yeah, the skull bones, they make them lighter because they're just pockets of air. They help with humidification of air. So at least when you breathe in cold air, it comes up to about 95% humidification. They help with warming up the air. It comes up to about 34 degrees when you breathe it in. And they help with producing mucus that can catch all these nasty things. And they also help with producing nitric oxide, which really helps. When you breathe in, the nitric oxide goes into the lungs and opens up the lungs a bit, so giving bronchodilation and vasodilation. If you remember a Nameless song where he was talking about
I remember that song.
Vasodilate, yes, scientific. It's nitric oxide does that.
So it didn't feel very scientific.
Yeah. Yes, yeah. So what people are worried about is sinusitis, and we can go into that.
Right.
Yeah.
Now, you said there are 4 types of sinuses.
Yes, yeah.
But before we go into each and every issue that, you know, they may have, that's why they may malfunction, if I may say that.
Yes, yes.
We have so many misconceptions, and you've broken down what they are, and that they actually are good for you. You need them because they're a function in your body.
Yes.
But one of the things I saw is, are they hereditary? Can they be contagious? If I have the, what you said?
The sinusitis, yes.
Sinusitis, can someone else catch it? And how would someone else even catch it? So I think let's break that down.
Let's break that down, okay.
Yeah.
So when we talk about sinusitis, it's inflammation. Now the word inflammation goes around, but you can get inflammation of any part of your body, including your sinuses, which we call sinusitis. So inflammation of your sinuses is sinusitis. Is it contagious? Well, the viruses that cause you sinusitis can make you contagious. So some of those viruses, rhinovirus, adenovirus, and all those other viruses, those are contagious. Number 2, is it hereditary? We do see some patients with, usually maybe 18% to 30% is hereditary. So you find that some patients actually have a strong family history of sinusitis, okay? And the other question is, can they be dangerous? Well, if sinusitis, the inflammation goes beyond the sinus and the nose, then the answer is yes. And we can go into that as well, how dangerous these things can be.
I see.
Yeah. So when we talk about sinusitis, inflammation, what does the patient come with? And usually we talk about major and minor symptoms. So what the patient feels is they feel this congestion inside their nose, they feel this blockage, they feel this facial pressure. What patients even say is that when they bend down, or even when they bend down to pray, they feel like their face is falling
off.
You know, well, sometimes they use falling, they say, but there's pressure going down. You have this discolored mucus, and you have...
I also read that.
Yes.
It turns green.
It turns green, yellow, because most mucus is clear.
Yeah.
You know, your mucus should be clear. So when it gets discolored, it means that there's a lot of inflammation happening around.
And where is the color? Like, what does the color indicate, if it's green or yellow?
So remember what I said, that most times it's a viral infection, but sometimes you can have a bacterial infection. And usually the discoloration of the mucus tells us that, hey, this now could be a bacterial infection, and we need to escalate and give some antibiotics. And then you get, but those are the major things that you have. But then there's some minor problems that you won't even associate with sinusitis. Headaches. Some patients get toothaches. Some patients get ear pressure. Some patients even get bad breath. Some patients even get fatigue. You'd never assume any of this is due to your sinusitis problems. So you'll see that patients are coming to me and are going to the dentist, and they actually belong to an ENT surgeon. You'll see patients going to a general practitioner and they require much more. They're just saying, I'm just tired, doc. Kumbe, it's your sinusitis.
Wow.
You know?
So some headaches, which may be migraines.
Yes.
For that matter, are actually sinuses, but you may not be sure because you've been getting normal treatment. I think for some, they even go to neurosurgeons.
Yes, yeah. So one of the biggest problems with headaches is that, especially, there's this preconception that a lot of headaches are due to sinuses. But actually, it's the opposite way. There's a nerve called the trigeminal nerve that goes into the brain. And some patients get migraines, and that same nerve goes into the sinuses. So you get you get sinus pressure. So you're getting severe headaches and sinus pressure. What happens? You go to the ENT surgeon. And then when I come see you, I do all the tests. Everything in your nose is perfectly fine. I refer you back to the neurologist because the problem is migraines. And we get a lot of that. And then some patients with headaches, actually the problem is their drippy nose, their sinusitis. So unfortunately, it's one of these masquerading diseases that you get to be seen by all sorts of different people when the person that you require to be seen by is an ENT surgeon or a clinician as well.
So how can someone narrow down what their issue is, especially you find some, you know, some doctors also who wouldn't be really quite, you know, straight up or, you know, forward in telling you that, listen, this is, I can handle this, but they'll take you through millions of tests and yet they just know can go to Ian.
So, number one, sinusitis is very common. And the reason it's very common is that a lot of it happens after you get a flu or a cold. So you can imagine how many patients get a flu or a cold. We're about 6,000 doctors in Kenya and only about 140 ENT surgeons in Kenya. So we can't see all of those patients. So the normal type of sinusitis, the acute sinusitis, that one mostly is managed by general practitioners. When things, if they can't manage it, then they should refer to us guys. For number two, as a patient, if you're feeling that, hey, I am not getting the best care, or I'm feeling that this thing is prolonging longer than 10, 14 days and I'm not getting better, come and see an ENT surgeon. If you're feeling, hey, I don't think this diagnosis has been fine-tuned, because that's our work as consultants, to fine-tune the diagnosis so that we can put you in the right direction, then come to us guys, okay? And we'll be able to sort you out. But one of the biggest problems is that because it is so common, everybody sees sinusitis, okay? And that's why it sort of masquerades, and we really have to do some of this work, especially in terms of like educating patients and educating staff, and also educating other healthcare workers, because I know some of them are listening as well.
I see.
Yes, yes, yes.
Now, we have viral and bacterial infection.
Yes.
And there's also an aspect where if antibiotics are not quite needed for this matter, you have to check if it's viral. How would you know the difference?
So how do you know the difference? So actually there are two types of sinusitis. There's one that we call acute and another that we call chronic. Now, those are medical terms. Lay people usually feel acute means severe and chronic means life-threatening. That's not the case.
I was so
That's not the case, yeah.
Are you sure that's the only two, yeah?
So acute in medical terms just means short, and chronic means long-standing. So acute sinusitis can be caused by either viruses or bacteria. Most of them are viral sinusitis. So when you get runny nose, you get a drippy nose, you get facial pressure, you get congested nose, that could be a viral sinusitis. Now, how do we know that we need antibiotics? When, number one, it's very severe, number two, you find that you get better, then you get worse, or number three, it's just not being managed, it's not responding to medication. And of course, the discolored mucus, greenish, yellowish, usually that triggers to us that, this could be a bacterial sinusitis, okay? So our work is to do a physical examination, do a history, do a physical examination and find out. And most cases of acute bacterial sinusitis, you can manage it just by history and physical examination. Now, for us as ENTs, what do we offer? Because we have to offer a bit more than what a general practitioner can be able to do, a medical officer. So when a patient comes to us, what we do is that we do a more detailed examination of the nose. We do endoscopy of the nose, okay, yes. Most people think about endoscopy only of the stomach, but you can do endoscopy of any part of your body, including the nose. So we do that in clinic. It's non-invasive. Puts a medication inside your nose to numb it up, local anesthesia, and then put a small camera inside the nose and look. And what are we looking for? We're looking to see if the drainage pathway of the sinuses are blocked. Usually that's the biggest cause. If there's any mucus or any pus inside, or if there's anything that could be causing this sinusitis. You have a deviated, used to be a boxer or used to be a football player, you get a deviated nose. You are in fights, you get a deviated nose, or even something like polyps as well, and we can talk about polyps under chronic sinusitis. And that's our work, to take a look inside and see what could be the cause of this thing. And we get the answer right there and there. We see it on the camera, and we give the patient, hey, this is your problem, and this is the treatment pathway. And then many ways of treating, and we can go into that a bit later on.
Okay, so
that's acute sinusitis, yeah.
All right, yeah,
yes.
Yeah, you're going into chronic. I was even going into the aspect of surgery, but now you're explaining chronic.
Yes, yeah. So now that's acute sinusitis, and most that usually sorted out by nasal sprays, nasal decongestants, steroid sprays, and if it's bacterial, antibiotics. Okay. Now, when we say it's chronic, for us as doctors, anything longer than 12 weeks, so 3 months or longer. So chronic doesn't mean a death sentence. Chronic just means anything longer than 3 months.
In terms of the pain and
in
the
terms
discomfort
of
that you're feeling?
Yeah, it could be on and off, on and off. It's not that you're having pain for 3 months. It could be on and off. Today is a good day, today is a bad day. You have a bit of mucus, you have a bit of facial pressure, you know. And a lot of these sinusitis problems actually cause problems with quality of life. So you find that you're in the office, everyone is asking you, hey, kwa nini uko na homa kila wakati, you know? Or you are finding that when you speak on the phone, everyone is asking, hey, your voice has changed a bit. So patient comes in, says, hey, doc, I've been having this issue for the latter part of the ear. I'm having this, all these symptoms, you know? And we put in that camera and we take a look and see. And usually at that point, we either offer advanced medication or even surgical options, you know. And advanced medication is takes a bit longer, you know. Change the certain antibiotics, change the steroid sprays, change the normal salines, that the douching, something they call nasal douching, where you actually clean inside your nose.
Is it the one that is it the nasal irrigation thing that you pour like with the kettle through your...
Yes, yes, yes. It sounds complicated, but when you look on the internet, look on YouTube, look on TikTok, you'll actually see that it's very straightforward. A lot of our patients do it.
But before we even move forward, how is the science with that? Because if you're pouring through this part of the nose, yes, and then it comes out. So how do you do it in a way where you... Please explain
you don't, okay.
Yeah.
So how the nose is set up, you have a right nose and a left nose, and they're connected at the back of the nose, okay? So they're connected at the back. And then the sinuses have very small openings into the nose. So what normal saline does, how you irrigate, is that it removes allergens, removes mucus, it removes all these dirty particles from one side and chucks it out of the other side. And what it does, it's like cleaning of the nose. It's like hydrotherapy of your nose, and it works fantastic for patients. And what patients feel is that they feel so relieved, you know. So usually what we give patients is like a 20 cc syringe with normal saline, and they just push it up their nose and it comes out. And they do that about 3 times in a day. And it helps moisten and remove all that yucky and gunk and all that stuff. And they feel a lot of relief. It's fascinating. And actually mothers do this a lot for children when they have got a stuffed nose, because little babies don't know how to blow their nose. Yeah. So mothers do that, but with normal saline drops. The adult nose is bigger, so you don't use drops. You use actual large volumes of saline. Yeah. And so with chronic sinusitis, that's one of the ways that we treat it. And patients feel, doc, that has worked for me. So can we continue on with that? We say, if it works for you, then move on. Do we need to escalate management? Yes, no. Do we need to do anything surgical? Yes or no. And I can let you know about surgery and all that stuff, yeah.
I see. Now, what if someone has gone into surgery for something that didn't need surgery? What happens to your sinuses?
Okay. So our work is to open. Remember, I've told you the sinuses open up into the nose with very small passages. So our work is to make those passages much bigger so that the nose can do 2 things. Air can get into the sinus, and whatever is in the sinus can get out. Because remember, what is happening is that when you have sinusitis, there's blockage within the sinus and mucus accumulates. So our work is to get rid of all that stagnant stuff inside the sinus, get it out. So we go into theater and using, so there are no cuts, there are no bruises, all of it is endoscopic, minimally invasive, and get inside and open up the sinus and get rid of all that stuff, all that mucus, all that gunk. Open up all the sinuses, below the eyes, in between the eyes, behind the eyes, open all that stuff. So you can get one big cavity. Now, that is one step of the therapy. It's multi-step, and then we now sort out the with now medication so that we can prevent recurrences. And for some patients who have what we call nasal polyps, they get this, we remove so polyps are growths inside the nose, and we remove them all. And remove them all so that you'll be able to breathe and you'll be able to smell as well. Because remember, one of the symptoms is lack of smell.
Yeah.
Now, at the beginning, when I talked about the symptoms, unfortunately, you can mistake sinusitis for a lot of things, okay? I've said facial fullness, you can mistake it for headaches. I talked about dental pain, you can mistake it for dental issues, yeah. Okay? Because remember, the sinus is just above your teeth. Bad breath, you can mistake it for tonsillitis and so you'll go to another doctor. Fatigue, you can mistake it for general stress and all that.
Yeah.
Now, polyps, one of the key symptoms of polyps is lack of smell. And remember, we've just come from COVID pandemic. One of the symptoms of COVID was lack of smell. So there was a lot of confusion and a lot of patients worried, am I getting COVID or am I getting polyps? So that was a huge issue for us guys in ENT during the COVID pandemic.
And how are you able to, know what COVID is and still, be able to marry that this is a sinusitis?
A sinusitis.
Yeah.
So we have one tool that really helps us, and that is called a CT scan. So send a patient for a CT scan, and actually what you find is that the scan will tell us, hey, do we have a sinusitis, or is the nose clear, and could that be COVID? Of
Actually,
course,
just before we continue, we have on our screens a WhatsApp message from Dan. He says, I have had sinuses for 7 years now. How can I get in touch? I totally lost sense of smell and taste.
Yeah,
wow.
yes.
7 years.
7 years. Remember I said chronic. Yeah. So our definition is 3 months.
So hold on to that.
She's had it for 7 years.
Yeah. Actually, it's he had it.
Oh, sorry.
Yeah. Just hold on to that. We'll be back, and Dan, Dr. Ian here, will be able to give you assistance on the same. Do stay with us. We'll be coming back shortly.
Yes.
Yeah. So that's
7 years.
7 years.
Oh, 7 years.
Wow.
Patience.